And welcome to the Memphis and Shelby County Joint Task Force update. As many of you know, we were doing updates on Monday, Wednesday, and Friday. But upon the release of the Back to Business plan, we wanted to assure that we were giving updates Monday through Friday at a minimum. And so on Tuesdays and Thursdays, it'll be primarily the health department giving updates on data specifically. And if there are questions that are more broad, Chief McGowan has joined me today and can answer questions on behalf of the city. And Dr. Randolph has joined me to make a few comments on the upcoming health directive that we expect to align with the Back to Business plan. As of today, we have 2,358 individuals in Shelby County that have been diagnosed with COVID. That's an increase of 38 since yesterday. Several of those are actually cases that were tested on Friday or Saturday, so we're continuing to see some of the numbers trickling in from the expanded testing that we saw over the weekend. We've experienced 46 deaths thus far. And really great news is that over 25,000 people have been tested, and that's really a testament to our community-based testing sites, as well as Walgreens and Kroger's offering testing and ongoing testing in our healthcare systems. We're going to continue to strive to expand testing to assure that there's access across Shelby County, and that we're focusing primarily on those who are symptomatic, but as time goes on, we'll do targeted testing either in geographic areas or in select populations where we know there's more risk of transmission. There's frequently a question about our contact investigations and our ability in public health to do contact tracing. Thus far, we have been able to close 78% of our cases, which is 1,852 cases closed. We've identified over 4,000 contacts thus far, and those individuals have been quarantined or isolated as appropriate. And as of today, we have 1,881 individuals who are actively being monitored. Also, many have been interested in the recovery rate, and as I shared yesterday, we're able to provide that information currently. So we know out of our 2,358 cases, we have 1,149 individuals who have recovered. As I noted, 46 deaths, which is about 2% of our cases, and we still have over 1,100 people who are actively recovering. We continue to have high percentages of our cases amongst younger people, but we're beginning to see more and more above the age of 60. That's very important because that's a vulnerable population, a very high-risk population. So I'm going to end there with the data updates and really move to a few actionable items. As we move closer to being able to get fully back to business, the social distancing orders and adherence to that are going to be critical. We want to continue to decrease transmission, not only in the community at large, but really within our home settings and within our workplaces, as well as truly protecting our most vulnerable populations. So I want to encourage individuals who have any signs and symptoms of COVID, and that can be anything from a mild fever to flu-like symptoms, shortness of breath, or respiratory problems, to seek testing so we can have a better sense of who's infected in our community. For those who are essential workers, particularly in nursing homes, if your facility offers testing, I encourage you to avail yourself of testing. We'll be partnering with the state health department and the governor's office to offer some testing to nursing homes over this week and the upcoming weeks, and to avail yourself, particularly if you live in a community that has high percentage of testing. And that map is located on Shelby TN Health under coronavirus. And if your zip code has a high level of cases, please avail yourself of local testing as well. I'm going to turn it over to Dr. Randolph to make a few comments on his upcoming health directive and alignment with the Back to Business orders. Then we'll open it up for questioning.
Thank you, Dr. Haushalter. Good afternoon. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. What I'd like to do is take this opportunity to inform you that effective today, that I issued an addendum to this is the second addendum to the Health Directive number 2. In this addendum provides guidance for preparation for opening in the future. This guidance directs members of the aforementioned groups to develop long-term safety measures, and it is primarily for the purpose of information and notice for preparation. In this addendum, pretty much provide the overview for the threshold criteria and safety measures that should be met before we can move into phase one of our reopening. Also provide specific parameters and things that must be done. I want to remind everyone that we are currently operating under the Health Directive number 2, which limits certain businesses from operating, especially those that are not providing services that we consider essential. We're also still encouraging people to practice safe distancing and to wear covering over the nose and mouth when out of the home, and to separate by 6 feet. This addendum that I've issued has been posted on our website, and so if you are encouraged and urge you to go to it to review it in detail, and I will stop here and address any questions you may have.
Sam Hardiman with the Commercial Appeal.
Hi, my question is about contact tracing, and it's for both Chief McGowan and Director Haushalter. How many people does the health department have contact tracing right now, and is it enough? And when the semi-permanent work that the library has been providing goes away, when libraries reopen, how are you going to fill that void?
It's a really great question, because one of the critical measures for reopening and continuing to remain open and move from phases 1, 2, 3 back to total recovery is the ability of the public health system to do very quick contact investigations or case investigations and contact tracing. Currently, we run 2 shifts, 7 days a week. Early morning up to about 9 o'clock in the evening, and we have anywhere from 20 to 25 individuals that are doing everything from receiving the case report to doing the investigation to actually monitoring individuals who are currently quarantined or in isolation. If an individual is identified to have barriers to staying in quarantine, such as they need food or some other assistance, we have another team that actually assists with that. We do anticipate that our staffing needs will continue to grow. Again, to stay open means that we really have to do contact tracing well and stay on top of that. So several things are underway to be able to try to address that gap. We're very appreciative for all the volunteers. We have had many, many people come forward and volunteer to assist us, but many of them have to return to work. Additionally, of our 550 employees, the majority of them are not in contact investigations daily, so they have to get back to their regular duties and responsibilities as well. So we have worked on a proposal that we're submitting, we being the health department, to Mayor Harris. That'll be shared with Mayor Strickland as well, to say here's what we anticipate our staffing needs will be for the next year to make sure that we totally reduce the impact of COVID locally, and we'll be looking for resources, particularly federal or state resources, to assist us with being able to fulfill those needs and to fill the gaps. Now I'll turn over to Chief McGowan.
If I could follow up.
Sure. Thanks, Dr. Haushalter. That is absolutely right. The federal resources that are going to be distributed to the states and localities, one of the appropriate uses for that is for increasing capacities of the health department to do several things, testing and contact tracing being one. We're very proud of the number of people that have stepped forward. The city and the county worked together to set up a very robust training program so that people who did not have experience but had the qualifications could step into that contact tracing role. When they do go back to work, we're hopeful that we'll be able to have a seamless transition using some of the federal funds to bring on board additional resources to do that contact tracing commensurate with the level that we need. Because as you know, the more testing we do, the more cases we have, the more contact tracing we'll have to do. Your follow-up, Sam.
It's for Director Haushalter. Is there a chance that the health department could release positivity rates by zip code? As we understand it, some zip codes in Whitehaven have been running a 20+ positivity rate, and we'd love to see those over time to understand where the outbreaks are and educate our.
Sure, we have had some maps with positivity density, so we can look more specifically at rates. I've also had requests to look at positivity rates by municipality. That's a little bit more difficult to tease that data out of the system, but yes, we're more than happy to do that. I would also ask that you just keep in mind that in some cases, the density of positivity is also a reflection of access to testing. That's why we're really working hard to get testing available across the county.
Omer Youssef with the Daily Memphian.
Good afternoon, everyone. I have two questions for Dr. Haushalter. My first one is about hospital data. I know that that's going to be one of the metrics you all use when deciding whether to reopen or not. So can we expect to see more hospital data in the daily reports moving forward?
Good afternoon. I've shared previously the hospital data is actually under the purview of the state. What they have given us permission locally to share is very high-level data, such as percentages of ICU beds that are available, and we can release the information that we have approval to list, and that would be things like capacity and percentage of beds used and percentage of beds available, the number or percentage of vents that are available, as well as negative pressure rooms. The one comment I will make is that we still have significant capacity in our community, and that goes to the healthcare systems who have worked diligently to make sure that they have maximized their ability to have negative pressure rooms, ICU beds, and staffing to support those beds. And your second question, please?
My second question is about testing. Today we had a pretty big drop off in testing numbers compared to the past couple of days. So could you speak on that? And also, as far as the goal of testing 1,000 a day, where do you think we are in that, and how do you think we can get there?
Okay, so if you look at the drop-off in numbers, remember that over Friday and Saturday, we had some significant, what we would call surge testing. So there was a large event at Christ Community in Fraser, and that allowed 485 individuals to be tested. We tested over 400 people at 201 Poplar specifically, and then both Walgreens and Kroger started offering testing. So we had anticipated that we would have an increase in the number of cases over the weekend because of those very targeted surge testing. What I want to remind everybody is that an increase or decrease in one day doesn't create the trend over time. So we're looking at the data over the last 14-day period. We also look really over many days, but 14 days at a time, to see if our trend continues to move downward. As we move forward, particularly with back to business and opening up, our focus really has to be on those clusters and those particular areas where we know there is continued transmission. So it's very much that hot spotting model of are there communities that need additional testing, outreach, and education? Are there specific types of businesses or key essential workers that we need to give more attention to? So this testing over the weekend helped us to really narrow our focus and where we need to focus for the next several weeks. Nursing homes being one, other congregate living settings such as the youth facility that's been mentioned, as well as individuals who may be detained in our correctional system. And you had a second question. If you'll repeat the second question, please.
All right.
My second question was about the goal of testing 1,000 people a day. How close do you think you are to getting to that point?
So we're actually fairly close to 1,000, but we've moved the target on that. So over the last several weeks, there's been much more discussion at the national level of the need to test 1 to 2% of a given population. So our calculations locally is that we should be testing somewhere between 2,400 and 3,000 people a day, ideally. And that would be first starting to make sure we have capacity to test that many, and then assuring people have access to that capacity and that they avail themselves of it. So much of what we're doing now is trying to educate the public on the need to get tested if they fall in the categories I mentioned earlier, particularly if they're symptomatic. One of the things I do every day is get up here and give numbers and talk through where to focus, and I've probably not given as much attention to the number of people who have stepped up to really give their all and give their talents to reduce the impact of COVID. And one of that is our testing team. We have a volunteer that's come from Church Health Center that spends her time all day, every day on testing, and all of our safety net providers, including Church Health, as well as Christ Community, as well as Tri-State and Cherokee, have all come forward to make sure that we can meet that goal. We had a meeting earlier today, and that was the discussion, is what can we continue to do to try to reach at least 2,750 capacity per day.
Brad Broders with Local Memphis 24.
Hi, everyone. Two questions. My first question is, I've noticed that the recovery rate is almost potentially going to surpass the current cases. How significant would that be, along with the ongoing percentages of contact tracing percentages going up to close to 80%? My second question is, I know people are looking at these maps, and there's a 14-day from phase 1 to phase 2 to phase 3. What would be your overall message to the community? Because this appears that it will be several weeks, and obviously things won't be completely 100% even in phase 3. Thank you.
So for your second question first, my main advice would be stay the course. We know that social distancing has had a positive impact, so we need to continue to adhere to the social distancing guidelines. Even as we move into phase 1, then to phase 2 and 3, there's going to be a need to continue to do some of the social distancing, particularly in wearing face covers, continuing to wash our hands, continuing to stay at home if we're sick. And it's beautiful outside. We all want to be outside, so it is a little bit more challenging right now to stay the course. So I really implore people to stay the course, that what we're doing is making a difference, and if we stay the course, then we're more likely to open sooner rather than later. Your other question has to do with the recovery rate relative to, the number of individuals who are recovering or who have had contact investigations. What we actually look at is the percentage of people who have recovered relative to those who have died, rather than the other numbers. Now, there's clearly a workload issue. The more cases we have, the more that we have to do contact tracing, but we know that's what we need to do, and we stay focused there. What's positive is that a significant number of people are recovering. And how we determine recovery is that if an individual after 21 days is not listed in the database as deceased, they can be viewed as recovered. So we know that people are recovering and getting back to their normal routine and daily activities.
Jackie Massey with Fox 13.
Hi, how are you doing? My question is about the criteria for reopening. So where is the county in terms of the testing capacity, and how much more testing do we have to have available before we're able to meet that criteria? And in terms of the turnarounds for testing, where are we in terms of that? Are we in a good place? What do we need to see before we can consider reopening? Would you also say it's accurate that we have met 6 of the 9 criteria that's listed? And then my second question, in terms of the new confirmed cases and the trajectory, are you looking at the number of people who are testing positive? Are you looking at the percentage of people that are tested positive? What exact number are you looking at over the 14-day period?
Okay, so good afternoon. I think I heard about 5 questions in there, so I'm going to try to hit on what I can. One was about testing capacity. We are doing quite well at expanding our capacity. Our goal would be to get above 2,400 what I would say spaces or appointments available, somewhere between that and 3,000, and we're moving towards that fairly rapidly, which is great for us. As we look at those who are positive, we're going to look at several things: the number of new cases per day, the number of new cases per day based on the date that they were actually tested, which is a little bit different number than what we report every day. Then we're also going to look at the positivity rate. If you listen to the national conversation, you want to have a positivity rate below 10, and ideally way below 10. So we have consistently run a little bit under 10, somewhere in the 9s up to about 9.9 or 9.8. That's generally a reflection that you're getting good representation through your testing and you're testing the right people. So we feel good about that and feel comfortable with that. But we want to be able to do more targeted testing, particularly of some of the high-risk groups, either essential workers, particularly nursing homes because we've had clusters there, and other targeted testing in key zip code areas.
Jacob Steimer with the Memphis Business Journal.
Yeah, I'd like to ask one question and then a quick follow-up. My question is, I'm told there's a hope that a reopening date could be set within the next 2 days. How likely do you think that is?
So what I would say from a public health perspective is we're really being data driven. So we are not going to set a date from our end till we know that we've achieved the criteria. We believe we're well in the right direction, but we are not at a place yet to say, oh, we're going to set a date in a day or 2 days. We understand that the community would like to have a date. It really does help with planning, and we know that, but it's important that we stay data driven and that we don't risk a resurgence of illness because we've opened too early or haven't paid attention to all the appropriate criteria.
Okay, and then as my other question, I know you're saying that the 1 day spike does not necessarily throw off the 1 day or the long-term trend, but it did move up. I mean, even if you're looking at like 7 day moving averages, et cetera, it did kind of bump us back up. Have you done anything more in the last day to kind of tell if whether or not we can set that aside because of kind of where the testing was targeted, or I guess is there any more insight than you had yesterday?
As of today, we have not made the decision to pull that data out. We're going to look at it further. We actually still have test results coming in from the Friday testing, so we want to wait till all those test results are in before we make a final decision and look at the impact, particularly because of the large numbers at 201 Poplar and at the youth facility and at Christ Community. We will be having a meeting later this afternoon to explore that a little bit further. And my goal is to have a more detailed report on 201 Poplar and the testing results and the actionable items from that testing tomorrow.
Stacy Jacobson with WREG. Stacy will come back. Kendall Downing with WMC5.
Hey everyone, good afternoon. I had 2 questions, and I promise they are only 2 questions this time.
Okay.
The first is about hospital systems and testing. I know that a lot of the hospital systems are doing different things. Some are testing all patients that are being admitted. Some are testing patients who have symptoms. Some are testing employees. Is there a recommendation from the health department and the task force about who in the hospital setting should be tested? Should it be everybody, all employees, that sort of thing? And then my other question is about contact tracing in the jobs. Is there an effort to try and perhaps train some of the folks who have been put out of work in our community to be able to do these contact tracing jobs?
So your first question about healthcare systems and their testing, those are actually organizational decisions. The health department is always happy to provide some technical assistance or insights, but healthcare systems have a fairly large infection control program within each of those systems, and based on their own internal data may make decisions to test more or less people. Let's just talk about nursing homes specifically. Some nursing homes have made a decision to test potential new residents coming in to make sure that they protect the existing residents. And that's an organizational decision that we would support. There are some facilities who also have sufficient resources and have had cases amongst employees where they have offered testing to their employees. And so we support and provide technical assistance, but at the current time don't have a specific recommendation. In many cases, particularly with nursing homes, we would encourage voluntary organizational policies as opposed to a very heavy-handed enforcement policy. Your second question was around contact tracing and investigations. Our hope would be that we can offer training to individuals who may have never worked in public health and may have an interest, or who have some skills that are transferable. An example is we do have some retirees who are investigators in law enforcement. That's a really good match with contact investigations. And so we can retrain people who have other skills to be investigators or monitors. And we're happy again to look at people who either may be displaced from other disciplines or professions, or who have an interest in public health. My personal commentary there is I love public health, I'm passionate about it, and so if we can get others interested in what we do and train the workforce for the future, it'll be a positive outcome from this particular pandemic.
Bill Dries with the Daily Memphian.
Yes, realizing our time is short. So given the data that you have, what would be your best general description or general summary of where we are in the pandemic? Are we still heading for a surge? Are we not? Are we flattening the curve? Just what is your best summary of that?
So the best summary is we're moving in the right direction, and we know that social distancing has worked and will continue to work. We have been at a plateau and a downward trend for some days. Because of the increase in positive reports this weekend, we went up a little bit, but we are continuing to monitor that to see if we will continue to either be at a plateau or a downward trajectory. My advice that I would end with is what I said earlier, is that we really need to stay the course currently and really implore everyone within our community to not only protect themselves and their families, but to protect others, and to continue to stay home and stay apart so that we can get back to business much more sooner.
And does the new health department guidance set any date for businesses to have their preparation in place for phase one?
No.
All right, we have time for one final set of questions from Stacy Jacobson with WREG. All right, Stacy's still having some technical difficulties. Oh, are you there?
Can you hear me now?
Yes.
Sorry.
Yes, Stacy, go right ahead.
Okay, I'm so sorry. I don't know what was going on, but thank you all for your patience. I wanted to ask about schools. In the guide that was put out yesterday, it didn't really set out a phased approach for schools reopening. Have you been working with the local school districts about a phased approach to reopening? And can you give parents any insight about the timeline on that and what that might look like? And then if you will, I have another question after that. Thank you.
So we haven't had recent meetings with the school districts. We have had meetings prior to them closing. We are having regular meetings with the elected officials, who also then will have conversations with their respective school districts. We're also looking to the governor's direction as he moves forward statewide. So I would say just pay attention, and we will give more on schools in the near future. I think it's been clear that we don't anticipate that schools will be opening this school year, but my hopes would be that children will be able to return to school next school year potentially. And your second question?
Yeah, my other question is about when you were referencing the decrease in new testing numbers. I know you said that you look at more of a long period of time versus just one day. But this is also something that you had commented on last week about some distrust of the medical community reflecting in the testing numbers as well. So it has been something that's been ongoing. Do you have any message for the community? If these testing numbers are going down because of a distrust, do you have a message for people about whether they should get tested and what your hope would be for those testing numbers to turn around.
And just for clarity, there are a variety of reasons why people may opt not to get tested. Distrust is just one of those. Others is whether people have insurance and think they might have to pay for it, fear that they might not be able to go to work. So there's a variety of reasons that people don't get tested. We're continuing to try to target our message to different communities, but my overall message would be that there is plenty of testing available in Shelby County through a variety of different places, locations, and venues. So I encourage people who need to be tested to get tested. One of the things that has come up just today, as a matter of fact, is concerns for individuals who may be fearful that we're going to report them based on their immigration status. And so I would say, particularly to the Latino community, that the purpose of having information is to make sure if someone's positive, we can get the results back to them, and that we can make sure that they're adequately isolated and their family is adequately quarantined. That data is not used in any way to report immigration status of individuals who get tested.
This concludes our time for today's briefing. Any closing statements from any panelists?
I just appreciate your continued commitment as the media, and again, ask people to stay the course. We'll continue to give updates daily, Monday through Friday. Thank you.
Thank you, everyone. This concludes our briefing. Please stay safe and healthy, and we will see you